Hello, my name is Alejandro Salgado, and I am the analyst that was tasked to see how a medical staffing agency can distribute additional medical staff to aid with the next flu season. The aim of this project is to determine when to send staff and where to send them. Some background information includes that the U.S. has a flu season where more people than usual suffer from the flu. Some people, particularly those in vulnerable populations, develop serious complications and end up in the hospital. Hospitals and clinics need additional staff to adequately treat these extra patients. The medical staffing agency provides this temporary staff, and it is important to note that the agency covers all hospitals in each of the 50 states in the United States, and will be planning for the upcoming influenza season. The data we use is from 2009 to 2017. And in order to know when to send the additional staff, we need to see when the flu season begins and when it ends. We know that flu season occurs throughout the year in the US, and to find out when the peaks are, I looked at the data from the CDC. And according to the CDC, in the United States, flu season occurs in the fall and winter. While influenza virus is spreading around, most of the time flu activity peaks between December and February, but activity can last as late as May. Looking at the chart here, it shows the influenza death rate per state. And with that information, we can see that the population size does play a role in the death rate. An example would be California, where the higher population, the higher the death rate. And one thing to note here is in 2016, I did notice there was a dip in deaths and for most states compared to 2017, where there's a spike for most states. And moving on to the next slide here, we're going to be taking a look at the correlation that was found between the population size and death counts. Here we're going to be looking at the most recent data from 2017, and we can see a clear pattern of having a higher population size does equate to a higher death count. For example, again, you see here, California has the highest population and as a result, the highest deaths, as opposed to Wyoming, where they had a low population and a low death rate. This can determine where we should send the additional staff to. And in order to determine where to send the staff, we first have to see who is the most affected by the flu season. To do this, we need to know who is the most vulnerable. Per the CDC, a vulnerable population includes adults 65 years and older, children younger than 2 years old, pregnant women, and people with certain health conditions. For the purposes of this project, we will look at the population over the age of 65 since they have the most deaths and are considered vulnerable. Our non-vulnerable population would be anybody under the age of 65. For the visuals here, we see the box plot chart on the top left, and it clearly shows that the highest amount of deaths are from people over the age of 65. You can see here that from the 10-year age groups that 65, 75, and 85 plus have the highest death count. The bar graph on the top right shows the difference between vulnerable deaths and non-vulnerable deaths. For most states, you can see that the vulnerable population makes up the majority of deaths. For example, you see here Florida has a vulnerable death count of 19,148 compared to non-vulnerable of 6,476. And there is an interactive element to this graph where you can choose a state and see the 10-year age group's death count. For example, here, if I choose California, I would be able to see the death count for the 10-year age groups for California, and I would be able to do that for every state. Moving on to the next slide here, is showing a map is another visual that shows the states with a higher vulnerable population equates to higher deaths. The darker shaded blue the state is, the higher the vulnerable population. For the circles, the bigger the circle, the more red the circle, the higher death count. We can see that states like California, Texas, and Florida have high vulnerable populations and a high death count. An interesting observation that I made is that typically since flu is more active during the colder seasons, we might be more inclined to suggest that the colder states may have higher death rates. But we can see here that the states with a high death count, such as California, Texas, and Florida, are traditionally warmer states, suggesting that population plays a big role. Moving on to the final slide here, of conclusion and recommendations. Depending on the state and the time of year, we can see that there is an increase in flu cases. Like I said earlier, December to February are the peak months, and it is best to focus most of our time and efforts throughout that time. We have seen that there is a correlation between a high population and a high vulnerable population having more deaths due to influenza. And for the recommendations, the first recommendation would be sending additional personnel to the top 5 states with the most deaths and vulnerable population. And these states include Texas, California, Florida, New York, and Pennsylvania. Another recommendation would be having a plan to deploy all staff around the country before the next peak season starts and start deploying them by November. This way we will be prepared for the peak season. And then preparing a contingency plan is important to keep additional staff up until May. That's if it's needed, as the peak season can last up until May. And another data point that would be interesting to see regarding the possibility lowering death counts and easing staff needs for future seasons would be seeing what the vaccination rate is and what could happen if we increase the amount of vaccinations. Another potentially helpful analysis would be performed to see whether there is a correlation between money spent on public health campaigns and the influenza infection and death rates. This research can assist in providing valuable information for a smooth and better experience to staff and patients for future seasons. Thank you.